Today is also an important day of celebration in health the world over. It is the International Day of Nurses. Our nurses have been at the forefront in this fight against coronavirus as the first point of call in our various health facilities. These healthcare workers make tremendous sacrifices every day as they place themselves at the risk of contracting the virus in the call of duty to make sure that those infected are well taken care of so as to make full recovery, to regain their lives, and also reunite with their beloved families. To recognize the wonderful work of nurses around the country, I wish to remind all relevant stakeholders the importance of investing and supporting the nursing profession. Let me now give you the test findings over the last 24 hours. Since our last update yesterday, we have tested 978 samples, out of which 15 have tested positive for coronavirus. Of these 15, 14 are Kenyans and one is a Rwandese national. In terms of age, the range, the youngest one is 1 year and 8 months old, while the oldest is 62 years. 10 are males and 5 are females. 2 other individuals from Tanzania at the Isabania border also tested positive and were referred back to Tanzania. If you recall yesterday, I said that at the border points, we are also testing those Tanzanians who want to cross over, but we are testing them while they are still on their soil and then sharing with them the results of the test. So when they turn out positive, these Tanzanians, because they have trekked through the Tanzanian soil, need to be able to go back for isolation, but also for the contact tracing that the Tanzanian authorities need to do. So when we say that they were tested, I want it to be made clear that they were tested while they were on their soil, the other side. This number is distributed in the counties as follows. 7 cases are from Mombasa and 3 from Migori, 2 from Wajir and 1 each from Nairobi, Machakos and Kiambu. This brings the total number of those who have tested positive thus far in this country to 715. The spread of the positive cases by estate is as follows. Mombasa, Mvita at 5 cases, and 1 each from Jomvu and Kisauni. In Migori, the 3 cases are from Kuria East, in Tebesi, and Yamaranya. In Wajir, the cases are in Bulait Dere, in Wajir South, and Grif Tuhaga in Wajir East, West. In Nairobi, the 1 case is from Githurai 44, and in Machakos from Katiani. I would like to report that today we have discharged 8 people from hospital. This now brings to 259 the total number of recoveries from COVID-19. We continue to appreciate and thank our healthcare workers for this great work that they are performing. We are also saddened to announce that we have lost 3 patients in Mombasa. 2 of them died at home, while the 3rd one died in hospital. These deaths bring to 36 the total number of those who have succumbed to the disease. Our heartfelt condolences go to the bereaved families and friends. The Ministry of Foreign Affairs is donating today 300,000 pairs of protective gloves, 170,000 pairs of medical shoes that cover the shoes with which medical practitioners work with, 300 pieces of overall medical gowns, and 1,500 pairs of goggles to protect the eyes of the various practitioners. We are also very pleased because our embassy in Beijing has been working very closely with those who continue to wish us well. And from private companies and firms in China, we have received 6,000 N95 respirators, which are for masks for protecting the individual health practitioners, isolation gowns, 500 pieces, surgical face masks, 3,000 pieces, surgical protective suits, 500 pieces, thermometers, 40 pieces, and the normal face masks like what I am wearing, 85,000. I think you will all recall that we were very clear that the exercise in which the Ministry of Foreign Affairs was engaged in was an exercise of facilitating the return of stranded Kenyans who find themselves caught up in the lockdowns around the world. So far, we have facilitated, as has already been explained, 700, and we do expect a few more to trickle in over the next few weeks as the time goes by, as we find means and ways of facilitating their return. So I wanted to make that point, but also to emphasize that many Kenyans around the world are recognizing that it is important that they stay where they are, that they are best advised to remain where they're domiciled, especially when it comes to the Kenyan diaspora. So in the example of those who came from China, even though we have over 3,000 Kenyans in China, when the opportunity was presented for them to return, only 169 took the flight. We did not fill the aircraft. This shows you that even though people recognize that there is a danger where they are, but they recognize the inevitability of remaining where they are because life must go on. And many of them have lives to live, livelihoods to pursue, education to complete, and so they prefer to remain where they are.